Now, we talked about how it's about a 4 to 6 week stay in the hospital. We talked about the diagnostic part, likely a few days, the treatment cycle of you actually receiving the treatment can be about a week to 2 weeks. And then as we watch your counts recover, they can take a longer time. So life may get a little boring in the hospital. Boring is a good thing. We don't want complications. But as you're kind of adjusting to your new diagnosis of acute leukemia, we want to think about ways to be productive and manage the time in the hospital too. So these are just a couple of things that we've talked to patients about, a checklist of sorts. They don't all have to happen, and they don't all have to happen in the hospital. Oftentimes, good clinic support can be helpful with these things. But just a few things to keep in mind as you're kind of passing the days as we wait for your counts to recover, that may be other helpful things that aren't necessarily medical interventions, but will be just as an important part of your journey with leukemia. You'll likely meet with a social worker, and they can be a very good point person for other supportive needs that may be part of your treatment and recovery. From emotional needs, they're great to talk to about this whole new experience that you're undergoing, as well as practical needs, as how can we get ready to get you home and what sort of supports would be needed at home. Additionally, support in general from local resources, either your own hospital team, other regional leukemia organizations or national leukemia organizations. We'll have a few of those on the last slide, but thinking about ways to take advantage of resources that need to be given to patients with leukemia to help them through this. Financial counseling can be an important part. We talked about physical therapy, often occupational therapy. Communicating with your primary care doctor can be helpful, and if you don't have one quite yet, this is a great opportunity to establish care. Talked about nutrition or dietitians to help support you with your nutritional goals. A palliative care consult that your team can place may also be helpful. Palliative care encompasses a wide range of services. Patients often think of palliative care equals hospice. That is not the case. It is one tool in the palliative care team's toolbox. And for some patients, it's appropriate, but there are a million other things that palliative care can do to help, including pain control. They've got brilliant strategies to help manage pain or other symptoms, nausea, vomiting, abdominal pain. The list is endless for ways that they can help with symptom control. Additionally, they also are another great resource to talk to about your goals, how you're feeling, how you're thinking about this new diagnosis and the road ahead. So use them too, if it's needed, to talk about these various needs that may be part of your new journey as well. Even paired with that, the chaplain, the hospital chaplain can stop by. If you are of a certain faith or religion, that can be a helpful part, or if not, they're just another good resource to talk with. And they can also help with maybe setting up some of those things like a healthcare power of attorney. This is a non-exhaustive list, but just some ways to kind of think about other resources that may be helpful to support you along the way.